glad that you accepted this interview.
I'm happy to do that.
And I was thinking to speak about a little bit about Ayurveda.
Yeah.
But first of all, I would like you to introduce yourself because I know who you are. So the people should know
Yeah.
what are you doing. And besides that, your name is Misha Raj and you're a doctor. What would you say about you?
Okay, about me it's very simple. Dr.Misha Raj. I'm working as a general consultant in Ayurveda Yoga Village in Karnataka, an Ayurvedic holistic retreat center. And I've done my graduation of Ayurveda in 2018-16, which has been 5.5 years of course. And Ayurveda is my passion, and then here I am right now healing people. And I'm happy with it. And this is what my life is going on with right now.
Okay, let's speak about Ayurveda a little bit. And what is Ayurveda and how does it differ from modern medicine? Because some people are putting the modern medicine and Ayurveda in different fields and they don't mix it together. And what would be the approach of Ayurveda to health and wellness?
Okay, so first of all, I need to give an introduction about Ayurveda. So Ayurveda is actually a holistic, natural science which has been originated 5,000 years ago. So it's a very old and authentic science which tells you how to increase your quality of your life. So it's very simple that we say. But there are also, like we say that prevention is better than cure, right? Nobody likes to go and get a doctor's prescription or anything. So the main two aims that we focus on Ayurveda is that to maintain the health of a healthy person. That is always the first objective of an Ayurvedic science. And if that doesn't go well, then what is next that we can do? Is that we treat the person, like we understand what is their problem, and then accordingly we treat them. If that is a diseased condition, we treat them accordingly. But always in Ayurveda is always about maintaining how good you can be, not getting into any disease or just increasing the quality of your life. This is mainly about Ayurveda. So Ayurveda is actually being done with, the language is all about Sanskrit, where our rishis and all have been written in slokas and everything about it. So because it's 5,000 years old science. So the word meaning, if you say what is Ayurveda, means it's two words actually. Ayur plus Veda. Ayur means life. Veda means science. So if you tell in small words, it said that a life of science, or the life dictionary that you can say how you can lead a happy, beautiful life and all of it. That is what Ayurveda is actually about, where it focuses mostly on what you need to eat, what exercises, like the treatments that you can obtain. There is a lot of going, and differing it with modern. That is another thing, because we do actually respect all the sciences. Every sciences have their own benefits and values. But Ayurveda, what we differ from modern is that modern or the allopathic medicine or the Western medicine, actually they focus on symptomatic actually. See what is the symptom is, and they give the medications accordingly. But in Ayurveda, we actually found out what is the root cause of the problem is. We make sure that the problem doesn't reoccur, and that's what the main thing is. But even though it doesn't reoccur, we do the treatments and protocols accordingly. It takes time. That is another a little bit of time that we need patience when you come for Ayurvedic treatment. That is what I always tell to my patients, because once you take the patients and come to an Ayurvedic treatment, and then you see a change within that, even though it is slow, the results are long lasting. So that is one thing, without any harmful effects or any side effects, you can get treated within time. And the other thing that I would say is that the same thing. I mean, we don't have any side effects or anything. It's not any symptomatic. We understand the root cause of it and then we treat it. So this is what the main difference. I could really differ. I can say that it's different from the modern science actually.
Okay. I know a little bit Ayurveda. I studied also myself, and I've been here too, and you explain it so many times.
Yeah.
But I would like you to explain a little bit about the concept of doshas and So what is Vata, Pitta, Kapha, and what are their main role in physical and mental balance?
Okay. So this is actually another interesting topic that we are talking about. So dosha or the tridosha that we say is the main energy that has been governing our system. And we say that this is actually what the primarily functioning or the controller. We say it as tripod of Ayurveda actually. Everything as a physician that we actually see the patient or the person within these three doshas. So these three doshas are Vata, Pitta and Kapha, which is mainly related with the elements of the nature that we say. As you know, the Pancha Mahabhutas, the either water, fire, air and then the space, right?
So 5 elements.
Yeah, the 5 Pancha Mahabhutas. So the universe, the human body, everything is made up of these 5 elements, right? These doshas, Vata, Pitta, Kapha, is actually having these connections with these elements actually. So if we speak about Vata, Vata is related to the wind. It is actually, we say it is the combination of space and the air, which is called the operating system of your body, where whatever movements that is happening in your whole body is governed by Vata dosha. For example, with the blood circulation, the respiration in your body, the evacuation of the movements, the bowel movements and all that is happening, the nervous system. So whatever is being operating within the movement, that is what Vata is actually controlling. When it comes to Pitta, which is made with the fire and water element, it is actually having the radiant energy that gives you the energy, the metabolism and digestion. What is metabolism? When you have food, the food is being converted to the energy and you need energy to do your daily works and everything. That energy is what is mainly Pitta is actually focusing on with. Like the nature that we will say the thing is like with the digestion, metabolism, the temperature, variations in your body, the skin and complexion, that is all related with Pitta dosha. Kapha, when we say about Kapha, it is mainly with combination of water and earth. That is the combination. So it is mainly of the structure of body and mind, we would say, stability that gives into your mind, the structure that gives, the compact that gives for your body and mind. That is what is related mostly with Kapha. So for example, the essence of your life that gives you the ojas that we say in Sanskrit, that is what immunity and everything, the structure which is being providing is mainly related with Kapha. So we say in Ayurveda is that all these three doshas has to be normal if it is in a healthy person. All the three should be balanced. If one or two doshas is vitiated or is imbalanced, there comes the problem. So the idea in Ayurveda is that all the three doshas should be equilibrium so that the person might be having a healthy lifestyle. So we find out which is actually imbalanced and then we will correct it accordingly.
But that doesn't mean that you have to have like Kapha, Pitta, Vata in the same amount.
No, it is like, in each person there will be a dominant dosha. That it will be by single dosha or it will be a bi-dosha. And that is what we actually tell the person so that they have to be careful that their dosha will not get triggered. So each person have their own identity. In the same way in Ayurveda, they have each identity of their of dosha actually. So we tell them that you should not trigger your dosha because there are chances that it can get aggravated, and then we as a doctors, we actually give them all the guidelines to keep it all under control. So every human being have one or two doshas dominant in their body and with the mind. This is all actually related. So for example, if I would say, if a person dominated with Vata and if it is imbalanced in his condition, if it is going out of control, he will be a lot of restless actually. He will not be able to do any work. He will be multitasking in his mind. He will be having a lot of thoughts in his mind, voices in his mind, like anxiety or restlessness. What should I do? What should I do? Is this not what I'm doing? Is it correct? Or is it not? It is not going in a well way. And that person will not be able to be sitting somewhere, stable somewhere. He will be running and then restless mind, and that's a movement that is going accordingly in that person's body, which is being balanced, where this is what we correct through Ayurvedic treatments and medications to keep it under control. For example, the other example that I can give is that if a kapha aggravated person, if kapha is being imbalanced in their person, they feel a lot of sluggishness in their body. They will not be able to move. That laziness that is actually can really conquer them. Or if the kapha is aggravated, they will be so, they feel like very much sluggish and lazy. They will not be able to do something work. They will be unmotivated. So there are a lot of things that we actually consider in a person, and accordingly to that we do Ayurvedic treatments and make it happen. So Vata, Pitta, Kapha is like very important.
You were giving me the other day a very nice example about Vata Pitta Kapha.
Yes, about for those who have been very new, it's like we actually give for the beginners to understand about Vata Pitta Kapha. It's like imagine your own phone. If you're coming up with Vata, what is Vata? For example, in your phone, your Vata can be the iOS or the Android, and that is the operating system of your phone, right? The same what it does is that it is like in our body, the operating system, the nervous system, the movements that has been happening that we can correlate with. In a phone, when the battery is down, you put in charge, right? Same as when your battery is down and if you're feeling very much tired, you go and have a food. When you have your food, your energy is back. And this is how that we can correlate within your phone. You put a charger or a battery to it. The kapha that we can relate is the phone as it is, the structure of the phone, right? As same as the body that we can see. So this is actually an example that I can give, same as a phone, like the operating system, the charging system, and the structure of the phone. Like that we can relate, or we can give as an example with when we are comparing it with our human body. Just for the beginners, that can really help us.
Very nice. I know you have spoken a little bit now about the personalization of the healing. How does Ayurveda personalize these treatments and the diet according to individual constitution?
Yes.
Because, for example, if I am a Vata, I am a Vata person, but if I am a Vata person, I said sometimes I'm lazy and feel so symptomatic from the kapha imbalance. So because usually we tend to understand that if we are Vata, then we are acting only on that level. Then we forget that even if we have a small kapha, maybe also that will come down. So how actually does Ayurveda personalize these treatments?
In Ayurveda, we have different kind of methodology that we understand the human body. Each body has its own kind of variations. It's not in the same way that we actually treat. As I'm not comparing it, but just to give an example, but if you go with a modern science, for each conditions we have each medications like symptomatology that I told you before, right? But in Ayurveda, we do not treat in that way. We actually mainly check, as I told you before, we check the three energies, how balanced or imbalanced it is, like Vata, Pitta, Kapha, which is vitiated, which is elevated, or which dosha is imbalanced. First, that is the main thing that we will find out. The second thing that we find out is the strength of the person, how weak or how much strength he is having to just to withstand whatever treatments that we are giving. The third thing is the immunity of the person. If there is any immunological problems that the person is suffering from, that is also one thing. So mainly in Ayurveda we say that we consider Rogi Bala and Roga Bala of the person. Rogi Bala means the strength of the person. Roga Bala means the strength of the disease. So these are the two ideal points that we doctors actually find out in a person when they come for the consultation. It's like a history that we will understand what kind of troubles they have taken, they are having, and what kind of food they have been having within their history, which food actually made this trouble inside. So there is actually a very good time that we have to sit with the patient, make a really good interaction with the patient. So from all the past that they had, we can find out a lot of mistakes that they have been doing for a longer time. So this, when they do it for a longer time, there is a lot of changes that has been happening in their body. So from that we understand, and then we do a permutation combinations within the medicines, and then we treat the person. So for Ayurveda basis, we do not have certain given medications or diet. It's depending upon how the physician or the Vaidya see the patient, understand his problem in his yukti, we say. Yukti is the ideal which he actually understands from within the person, and then we give the treatment accordingly. So each person has a different way, and then we do the treatments accordingly. We do not have written treatments like for each condition, this is the treatment. We do not have that. We understand the root cause of it, and then we treat. So you mean like every cause has an effect, right? This is what Ayurveda actually teaches. The cause is the main thing that we find out. So we go back to the history, and then we correct it. And then we give them the correct diet, and then we do the correct treatments. We actually advise them the correct exercises that they need to do, because every people in all the conditions, they will not be able to do all the yoga or asanas that we say, or the exercise. So we understand in all the aspects in the consultation, and then we give a good treatment of all of them.
What about mental health in Ayurveda? How does Ayurveda address mental health challenges like anxiety, depression, and other psychical conditions that are so prevalent today? Because all the diseases sometimes in the modern world is like very related to this kind of anxiety and depression and so much work and so just the fastness.
Yeah, of course,
the modern world.
Yes. Most of the patients that I'm getting is also, a lot of them is suffering with this, and I would say within a 20 to 30 years of time, what disease that you can see all around within you will be the stress, anxiety, depressions, panic attacks, and this will be the thing which is being now more getting used with all the people actually that I see. All the people, one or the other, they might be suffering, mentally, they will not be happy. There will be mental disturbances they're having, either from the work, either from their colleagues, or either from any of their environmental issues that they are having it, and that also causes in their physical aspect. In Ayurveda, it is actually we treat Sharira, Prana, Manas, or we say that we treat accordingly the body, mind and soul. All the three dimensions are very important when as a doctor, as a physician, that we check upon them. These all are actually linked with. If you're having a physical trouble, that will definitely have an impact on your mental health. If you're having any mental impact, that will definitely have an imbalance, in your physical health. So we acknowledge one of the imbalance can really impact on the other. This is one which is mainly that we do in Ayurveda, or we check in Ayurveda to understand. So when it comes to stress, anxiety, depression, we also ask our patients, how good you're feeling. We also ask how is your workspace, or how is it with your family, or what is it actually bothering you. And also we have cognitive therapies, we have behavioral therapies, we also have a section in Ayurveda called Manasa Roga, where we have also deal with psychiatry and everything. So it's all about not psychologically that we treat the person, because this is all linked with. So we address whatever problems they're having mentally, and then we give the treatment, because each treatment actually has an effect in the physical part, in their mental part, and also in their spiritual part. So it's all together that we actually consider, and it's all linked with. So it is very important as a physician that we have to address all the three, because there will be also like child trauma for each of the person, and they will be carrying it throughout. And this trauma can really make a lot of impact in their mind, and that impact can really cause a lot of bodily changes in their, maybe getting a lot of pain in their neck, getting a lot of strain in their shoulders, getting less of appetite, not even feeling to eat because their mind is somewhere else. They're not even able to concentrate. They start getting stiffness and all over their body, and they're not able to move. So this is all actually linked upon them. So we actually address the mental stability of the person and physical stability, and it is very, very important. It's not only about physical aspect in Ayurveda, it's all together that it's a problem.
Yeah. And about that, because always we are thinking about Ayurveda like a medicine which is only about plants and good diet and maybe meditation. But actually, Ayurveda is a medicine that you studied for 5 years, 5.5 years.
Yeah.
And the fact that there are, like in modern medicine, there are different patterns that you can go. You can go on the psychology, you can go
Yes. We have all the departments actually, because in a human body it is very important that we have to know everything as well, right? As if we say that in the first year we learn about anatomy, physiology, we learn about the Sanskrit, the base language. In second year we learn about the preparation of the medications. Third year we learn about diseases, the whole diseases. We have all the departments starting from gynecology, obstetrics, we have ENT, ophthalmology, we have surgery, we have general medicine, we have psychiatry. So we actually get into all the departments, and it's very important that Ayurveda is not only about just cleansing, or it's just about, we have treatment for all the conditions, and it is not an easy task to actually to learn and then to go and to know about everything. But we learn each and everything. We also learn the modern aspect of it, which is very important, because in Ayurveda we always correlate, because there are nowadays a lot of diseases there are a lot of diseases that most of the people have been new with. But in Ayurveda we have everything correlation. We have our own diseases names and all, which we also correlate with modern aspect, and so we find out, we do the permutation combination, we have researchers and all, so we do get the medications accordingly, and then we do. So we actually learn both modern part, not the medicine, but the other part, the symptomology and the anatomy, the physiology, everything that is going in your body, and we also have the correlation with Ayurveda. So it's like, you would say it's a double degree maybe.
Okay. Okay, and this is an ancient, actually, science, Ayurveda, because it's one of the oldest science that we know of. How does Ayurveda adapt to the modern lifestyle, especially for the people living in the cities and working 9 to 5, 9 to 6, 9 to 9?
Maybe more than that.
Yes.
Yeah.
Because it's very, everybody wants to have this peaceful kind of life where you can wake up, have your breakfast, and stay in touch with the nature. But the modern life doesn't allow you always to do that. And are there like small tips or small things that we could integrate in our life so we can stay balanced?
So speaking about that, you know that nowadays being healthy is a lifestyle choice. You want to be healthy, you can choose the path. It's like that nowadays that I can see that, when those who are living in the urban areas where most of the people will be more focused on their work, their priorities will be more of work, that they have to earn a living, they have to take care of their family. There will be a lot of responsibilities that they have to care. So they actually forget about they have to take care of their own health. They actually forget about health is the wealth. That is what we Ayurveda we actually make the people know about it. In this, when you come into the urban areas where you will not even be able to get with the nature, most of the people are disconnected with the nature. They invest most of their energy in the outside world. Like, it's a temporary happiness that you get, and but Ayurveda is mostly with the nature, that you have to get connected with the nature, even though if that is not possible. People get into stress, anxiety, and all these problems also comes up over there, and they will not be able to take care of them. So there is a lot of changes that is happening. In my experience that I've seen is that most of the people who lives in the city areas are more prone to get metabolic disorders. Metabolic disorders in the sense, this happens mainly because of two reasons: overconsumption or undernourishment. These are the most important part that a disease occurs. And the rest, 10 to 5% I can give for genetics actually. But most of the part that happens because overconsumption. Because they advertise in the way that they have to have this kind of food. Their lifestyle is changed because of a lot of catchy things that they come up with. And and they think that they get happiness through it, and they go for it. And they overfed themselves with junk food and then processed food. And there are a lot of food which is being now processed, which if you see in Ayurvedic aspect, it's actually treating a lot of toxicity in the body. So there is a lot of changes that people are tend to get this extra happiness, getting from their all work pressure and everything, but they're actually overfeeding them. Or because of the work, they will not be able to nourish themselves better. So they get this malnourished problem and everything. So all the diseases that I've seen so far in my experience is the metabolic disorders, which is because of overconsumption and malnourishment. So this is because of their work schedule, as I told you. That is the main thing. So what you can do, and that is that the main thing that I would recommend is food. Food is something that you have to really check on with. In Ayurveda, we consider food as the best medicine. And there is nothing that you can compare with other medicines or anything to get. Because we say that you have to treat your body as a temple. What you eat is what you are. So if you keep on feeding unwanted or unhealthy food to your body, after years, it shows all the inflammation, metabolic disorders and everything. So what we actually suggest as Ayurvedic physicians is that food. Correct food which is really not changing the imbalancing the bodily functions and everything. Eat healthy, and we give guidelines accordingly to it. Do exercises, which most of the people are not. They actually sit. Most of the people sit and do their work. They are lazy. They just eat in front of the TV. They're sitting in their couch and having their leisure time. They are not spending time with their family outside in the park or beach or wherever they are. So there is not even a movement happening in their body. So when there is not even a movement, the body gets stiffened actually. There is no, body needs a movement. Your body has to get a mobility, stability, flexibility and everything. If you don't move, it gets stiffened. So exercise is also something that we see a lack. Because of all the work pressure and everything, sleep is being deprived. And sleep is something that we say that is very, very important, essential, or an essential thing in an Ayurvedic lifestyle. If you get a good sleep, you're the happiest person. And that's what we say actually. So sleep is also important that the person has to get. The other thing is that, quality time with your loved ones, making yourself mentally happy, not taking everything, into yourself and just leaving, let it go, or acceptance, or don't burden yourself that way. So these are all the other things, but the first thing that we focus on that is food. When it comes to food, we say you have to have your food in the correct time. Correct timing is very important, because I understand most of the people having a lot of work, they will not be able to have food in the correct time. But it's their choice. They can find out the reasons. Nothing is impossible actually. It is said I am possible. So you can find out a way that you can, have the food in the correct way, and correct quality and quantity of the food is also important. How much you eat is very important. It's not that you have to stuff up your food, your body with the food. If you have a certain quantity and if your body is happy with it, that's perfect. That's healthy. It's that with the cravings and with the hunger that the people has to differentiate it with. Most of the people go with the craving. They do not understand what the body actually wants yet. They actually go with the mental happiness. Okay, this is so tasty. But the Ayurvedic food and all, most people that I've seen is that Ayurvedic food is not so tasty. But that's what your body needs. That is what your body is making happy. So this is something that I want people to understand, to differentiate with the cravings and with the hunger. And getting their own time, how much ever work that you are doing, take a little bit of time to get away from it. Just breathe in good fresh air, or be connected with nature. This is something that you can really help with, those who are living in urban areas and, walking
too much.
Yeah.
And could you share some common Ayurvedic remedies for everyday issues like stress, digestion problem, insomnia, something that you always can find in your home and you can use when you feel that?
Yeah. Most of the people started getting into the remedies that I have seen is after COVID. Because after COVID, they have seen a lot of immunity, boosting with Ayurveda and all. And they had found it in their own kitchen actually.
Yeah.
And from that they came to know, so this is also Ayurveda, you can just boost up your immunity. So mostly that I see is with digestive issues that most people is having, like indigestion, bloating, acidity, uh, not able to go for the bowel movement, not able to just evacuate. So for such reasons and all, not even having the medication, the other way that you can do is that drink ginger water. You can take one piece of ginger, just crush it up, put in 2 glasses of water, boil it until the color changes. You can see a slight change in color over it. Of it, drink the hot water as it is. So ginger is actually really good to improvise your agni, your digestive capacity. So whatever problems that you have been causing with indigestion or bloating, within a few hours it will get settled. Cumin water is really good. With cumin. And also you can add a little bit of turmeric in it if you want, because it is having a lot of anti-inflammatory, anti-infective properties. So these are all essential things that you see in your own kitchen. So having such a small, with cumin, with coriander is really good, with turmeric, ginger, just adding the water and drink daily. That will also be really good to improvise your digestive capacity, also your immunity. The other things that I've seen is with the sleep, insomnia. This is also the other thing, and it's also related with the mental health, like stress and everything. For them, that I would say is that it's not that there is a lot of, we have medications, but we actually tend not to give a lot of medications, and we actually guide them, in the proper way. Most of the people, when they go to sleep, they actually be most of the time in the phone. Because when the blue light emits in your body, and it's actually overstimulating your nervous system. So that is not actually putting you onto the sleep, it's actually making you awake. And that's also most of the people that I see, insomnia and all. So try to keep away all the social media and all things 1 hour priorly before you go to sleep. And try doing something calm, like go for a warm shower, or listen to some, calming music, read something. Because if you could say, when you were in your childhood, when you open your book to read, you'll fall asleep because it's boring you. The same thing, we have to trick our body. We have to bore our body. So your nervous system will get understimulated and it will put you into the sleep. So reading something boring is also something, it can put you into the sleep. It's like you're tricking your own body. And sometimes when you do something activated, when you see a phone, it's actually making you to see through it, so you will not get sleep. So these are some slight things, that we can really help you to achieve in a better way. And speaking about stress, meditation. This is the main thing that I would say to all my patients who has been suffering with stress, anxiety, depression, this alternate breathing techniques and all. We say pranayama for it. Just inhale and exhale. Listen to your breaths, because most of the people I've seen is that only if they have any respiratory problem, they understand their breathing is not in the proper way. And you breathe from your birth, but you're not even being aware. You don't get awareness over it. Only if they're having any cough or they're having any asthma, they come to the doctor and say, my breathing is having a problem. But if you have been doing meditations and all for a longer time, it's actually increasing your lung capacity and everything. So it is actually causing, the pressure from your body is being released. So breathe, inhale and exhalation. Just concentrate on your breathing. So these are very small things, even though without going with the, you don't have to spend a lot of money with all the medications and treatment. These simple things, and it is one important thing that I want to say is that be consistent. Consistency is very important. It's not that you do it for 1-2 days and you achieve it. No, we do not actually achieve that in Ayurveda. You have to be consistent. That means you have to do it daily so that you will see the result. Or else,
about this consistency, because also in yoga I have students who ask me about this consistency, and when I tell them that yoga has to be done daily, they are very scared, I am using this because I was also a student. I am still a student in yoga, but at first I was having this problem with consistency. So I put myself to do it like 2 or 3 times a week. So I didn't pressure myself. I didn't feel the pressure that I have to do it daily. So is it like, because I know that in Ayurveda to see the results, actually you have to have it daily. Also the treatments have to have daily. But in terms of like daily routine, can they introduce it, I don't know, piece by piece, small things every day, so they don't feel like pressure, because now they have to eat correctly, they have to do exercise, they have to do meditation, and everybody will say, yes, but I have to go to work, I have to take care of my children, I have to take care of my mother, I have to clean the house, I have to cook for everybody and for me. So what will be like, I don't know, or bringing it step by step, or maybe not daily, but a couple of days in the week, or how it would be.
Something getting used to the body is actually a difficult task, because when you do something, your body will be like, okay, wait, something new is happening. So should I process it or should I not? So this is the reason we say about consistency. But to get used to it, you can either do it in a small baby steps. Like you can implement it for, when you spoke about your students telling that you have to do the yoga daily, maybe they can start with 10 to 15 minutes in the beginning. The next day they can just increase 5 minutes more, so that your body is getting used to it. I can tell you a small example saying that there was a man who had a small calf, and he has been taking the calf daily. Okay? After years, and he has been taking the picture of, taking the calf actually. It's been years, and the calf has grown, and it's a big cow right now, and still he is holding it because he's doing it daily, and he is not able to understand the differences. If he was taking the calf in the first day, and then he have tried after taking it after years, he couldn't actually lift up a calf, right? So that made him, because he has been doing it daily, and he didn't even know the difference that has happened. So this is like an example, the same thing happening in Ayurveda. It's just that you have to add a little bit more for the next day when you do. But do not cross the limitations of your body, because every body has their own boundaries. And if you go beyond it, the body will react upon it. So do not, but try as much as possible and do it daily. Maybe just each day you just add with a very small step, and so that you will be able to, achieve it in a very good way.
Okay, also in Ayurveda there are a lot of misconceptions that I had them, and now because I studied a little bit of Ayurveda, I find it in so many people's, like, I don't know, can you share us some misconceptions that you know? Because for sure you, by having treatments, people are coming with these misconceptions already.
Okay, there are misconceptions actually, for true, because they take some that I've seen with my own experiences. Maybe I can share you one story. Like one of my patients was having chronic constipation, digestive troubles, that they were not able to go through the evacuation. And for the first few days, actually, I have recommended for taking some digestive laxative medications and everything. And that patient, I've told them to stop after that. But when they have gone back to their home, they started taking the laxative for a very longer period, thinking that in mind that Ayurveda is harmful. There is nothing that you don't have to worry about. It doesn't harm the body. Ayurveda doesn't have any side effect. Yes, we do not have any side effect. But as she has been taking it for a longer period, it has actually caused a lot of dryness in her body. And then she came up after years telling me that this medication is not really working, what really has happened. And I asked her, what have you been taking? And then she told me the medication you had given me years back, I've been continuing it and there is no change actually according to it. So one thing that I wanted to say is that in Ayurveda we have a quote saying that there is a sloka which we say that if you take something in correct quantity, it turns as an amrit or a nectar. It's actually really good for your body. But if you keep on taking it for a longer period, it actually turns like a poison. It means that you're abusing your body with something that your body doesn't want for a longer time. And it doesn't give in that way, because your body is being abused with the same kind of medication, and it's actually fed up in reacting to it. So this is one thing that I've told, that thinking that Ayurveda doesn't have side effects and taking a medication for a longer time. This is not really good. Yes, we do not have side effect, but we actually Ayurvedic physicians only ask them to take for a limit, and after that you have to stop it and see how naturally your body is moving. This is one.
And we are saying medicine like triphala,
Ashwagandha,
everything
yes,
which like
yes.
actually medicine,
Medicine.
not turmeric or
Yes, everything has its own limitations, as I told you before. We should not cross the limitations. We should not give something your body that doesn't want it for a longer time. It has its own healing properties.
Okay.
And when you take it for a certain time, it heals it. And then you have to wait for a certain period, how naturally it heals. So you don't have to take it for a longer time, thinking that it's not going to cause any side effect. So it's actually abusing your body. This is one thing. The other thing that I've seen is that I have had a patient. He was actually obese, he was overweight, and he came to our retreat center asking, Dad, I'm here only for a week. This much is my weight, and I need to reduce 15 kgs.
Yeah, this is the dream of everybody.
I said them, it's not actually possible, because it depends upon how your acne is. It depends upon how good your metabolism is, and it is not like we do magic. So yeah, it takes time. I would say it takes time, and I cannot assure you within how long, how many kgs. I cannot write it and assure you. I made him understand. It's something that people think that Ayurveda is for granted. You can do some cleansing treatments and you can reduce your kgs in that way. No, it is not like that. For one person, you will be seeing the results faster, but in another person B, if you say A and B, who is having of the same weight, or it's like an example, if he is overweight, and when we do an Ayurvedic treatment, if one A is actually showing a lot of result, the B might be taking time, because it is how his prakriti or his constitution is. We cannot change in that. We Ayurveda treatment, we do it accordingly how the body moves actually. So we cannot pressure the body just to do 15 kgs in 1 week. So this is also one misconception that I've seen, that Ayurveda can reduce kgs or reduce a lot of. Yes, we do detoxification, but it takes time. It is not like in 1 week we cannot reduce 15 kgs or so far. And the other thing that I've known is that, as I've told you before, Ayurveda is mostly about treating the body, mind and prana, right? Most of the people think it's only physical, or it's only based on mentally. So that is also one misconception that I've seen, but it's not only treating physical. We actually see the mental capacity, as I told you before, the spiritual aspect of the person, and then we help it through that. So this is not just one dimension Ayurveda is about. So these are the few misconceptions that I've seen so far, because Ayurveda takes time. You don't have to take something for a longer period. Your body has its own healing power, and Ayurveda is all about treating body, mind and prana. So far with my experience that I've seen.
And I also found like misconception that Ayurveda is very, spiritual.
Yeah.
And they don't treat it like actual science. And when I got here early this year, you were telling me that your center is doing like research on cancer, and you have a lot of patients, and you have a lot of good results. So it's actually a science.
Of course, it's a
Also
science.
today, it's not something like you stay here and pray for the cancer to go
No,
out.
no. It's actually both, we would say. It's actually combined.
Yeah.
The science,
Yeah.
the fact and the faith. It's
Yeah.
actually so much conserved. You have something, believe on something, keep the belief. It will help you. But also, on the other hand, we actually try to keep up with the science, because we actually in Ayurveda, there has been a lot of researchers and telling. We also have been getting cured. We have had cancer patients and all. It takes a longer period, I would say. It's not in the last stage you come for Ayurvedic treatment. There are cases that we will say openly that we will not be able to take care. We will tell that assured, we will tell them openly. But if it's in the first stage that we have seen, for a longer period, if you're being completely in Ayurveda, you actually regenerate your body cells and everything. Within years of time, if you see with the markers, cancer marker and all, there have been changes that has happened. So this is also Ayurveda to an extent that has been doing. So it's not only about neurological, autoimmune, it's not only about the digestive or both disorders, anything. Ayurveda has all the extremes actually that we have been treating on with. So yeah, it's not only about spiritually, it is about all. It's just, it's just the combination of everything. Faith and fact together. Yes.
And now because, okay, I'm a yoga teacher and mainly this is how I came to into Ayurveda. What is the relationship between Ayurveda and yoga? And how do they work together to promote this holistic?
That's a very wonderful question. Both the science, yoga and Ayurveda is a Vedic or an ancient science where both of them is actually being integrated with Sharira Pranamanas, which I said you, which is dealing with body, mind and soul. Ayurveda is mostly integrated or mostly focused on the physical well-being of the person. Yoga is also with the physical well-being, but also with the mind and consciousness, which is also very important. So both yoga and Ayurveda has a relationship where it actually helps you from mind, body and soul actually. So this is one thing. It's both having the same way, like we actually, if any of my patients is coming with a problem, I give them treatment, I give them medication and also suggest them these are also the asanas or these are also the meditation that you need to do. Because I tell them it's not only apart from the treatment that you'll be getting cured. You need to come with 3 sessions of yoga that we actually help the person. And so throughout after their holistic retreat or their stay, they would say that there has been a lot of changes with the movement, with asanas and everything. The body is having a lot of changes in their body and their body is also feeling with the flow. So I would say this is all linked together and it is having the same idea, treating the body, mind and prana with, we understand the subtle form of the person and then we treat accordingly to it. So it's the consciousness, it's the mind, it's the body, and both Ayurveda and yoga has the same view about it. Yeah, it's very
Okay, we are coming to slowly to the end of our interview. And for someone who is new to Ayurveda, where should they begin? Do you think that it's safe to Google things and take treatments from the internet and stuff like that? Because now because we have all this AI, you can Google it, give me an Ayurvedic treatment and give me a dosha questionnaire and I can see what prakriti am I, if I have this prakriti, what should I eat and so on and so forth. So what is your opinion on this?
truly being, frankly speaking, if you ask me about it, I would really ask to get a consultation from an Ayurvedic physician because AI and ChatGPT and all the Google stuff is doing a wonderful job, but you will not get everything what they say actually. Because I've seen a lot of my patients actually Googling their problems. They have their own diagnosis with them and they come and ask and they say, this is our diagnosis and we just treat us. But I say them, this is not how it works. You just tell me how is your problem with and how is the history and what they have told with the Google and what we have come up with is so much different because we see the symptoms. But in Ayurveda, as I told, it's not only about the symptoms. We have to go with the root cause of what is really happening. So it's the other thing is that usually it's called Mata Pita Guru Devam, right? Nowadays like Mata Pita Google and Deva. So there is no guru, they do not actually value, just they have the phone and they go with the tip of the hands to find out the reason. But that doesn't give you all. So I would say that if you really need a proper good guidance and advice about Ayurveda, you need to really seek the specialist advice. You need to find an Ayurvedic doctor or an Ayurvedic physician, consult them, tell them their problem, they will find out what is your problem accordingly and they will treat it because Google cannot really ask you questions, feel your body, understand what is your problem. They just give you a list of things, we see it and then we understand that's the problem, we found out remedies in it and then we do it. I have had a lot of my patients Googling the remedies and they have done it for themselves and that has gone wrong and then we have to do a double treatment on them We have to treat what they have gone wrong, and then we have to treat it in another way. So my suggestion is that you can Google, but it has its own limitations. You should not go and believe and have a thing about in the Google or the AI or something. Come ask an Ayurvedic physician, and if you're more interested, like to keep up with Ayurveda as a course, we have a lot of diploma courses, we have Ayurvedic courses, like if those who are interested to be a doctor, we have graduation like BAMS, Bachelor of Ayurvedic Medicine and Surgery. It's a 5.5 years of course, and if there is no, they don't want it to do for such a long time, there are also small courses like for dietitian, for yoga, for a different aspect where you can learn your body, mind and prana. So Panchakarma courses, and also you can find out what you really want and you can learn from it. And there are a lot of people and colleges that is giving the colleges. Try to get the correct knowledge, not just the outline of it and then understand something about it. Seek the correct specialist and understand what is really that you want and go for it. This is what I would really advise. Yeah.
And that you mentioned now the Panchakarma, actually I was thinking that I saw some advertising on the internet that there are people who are doing Panchakarma in 5 days, 1 week.
Not really.
So this is something very interesting because you are saying what are the Panchakarmas, and you Google it, and there are 5 practices, actions. Okay, you can do that in 5 days, no?
Yes, but it doesn't happen in that way. Panchakarma, as it is, I told you, it is a cleansing procedure. So we have to understand what is the problem with them, what has been really triggered them. We have to understand through that, and then we have to treat it. So Panchakarma cannot be done in 5 or 2 days, and it's not that you have to do everything. It says that the physician can really understand what is the problem, and we select which Panchakarma can be taken and be done. But it takes time. It takes minimum 14 to 28 days of time to do a correct Panchakarma. And if there is an intense toxicity in the person, it would take months of time to really cleanse the body. It depends upon the person, as I told you. Yogi Bala and Roga Bala. That is the main depending factor that we should handle. 5 days you cannot do Panchakarma.
And not in a weekend, no?
In a weekend, what we can do is a rejuvenative treatment, so palliative care. This is something that we can do, but not a Panchakarma that we can do actually. No.
Yeah, because people have to understand that it's like intrusive to your body. You are harming your body by doing these treatments.
So sudden. And the body doesn't give the results in that way. If you want something good to happen, this is something that you want patience, or something you need to understand the real science of it, and then go for it. Nothing is taken for granted. Everything has its own way, and this is how you have to go on with. Yeah. Perfect.
Of course, there are a lot of questions in Ayurveda, and we would stay and talk here for hours and hours.
Yeah, of course.
That's why I wrote only some 9 questions, and I put 11. Because otherwise we will talk forever.
Yeah.
But I hope that this will be a lot of fun in this. And of course, if there is an interest, a specific interest that people want, you can message me and we will ask Dr.Misha specifically on that. Of course, you can find Dr.Misha also in online sessions.
Yeah, I do actually online consultations, and also we have 4 actually retreat centers, and 2 in Kerala and 2 in Karnataka as well. So we have all doctors with all the protocols, and it's actually a professional and international center that we take care of, where we have all yoga, spiritual, and then treatments and everything. So you can find us in our website, ayurvedayogavilla.com, and you can also find me as I do online consultations and everything. So this is how that we can help.
Yes. And of course, if you want to find her, you have to come here in Kumta, which this is my favorite one, because it's by the sea. Yeah. And I'm a sea person.
Yeah. So you can choose.
Everybody can choose mountain, sea, whatever. Okay, thank you very much, Dr. Misha, for everything, and of course, thank you for treating me, because it's the second time that I'm here. So
I'm glad to hear that.
Thank you very much, and hope to hear from you soon.
Yeah, of course. Thank you for giving me the opportunity as well. Namaste. Namaste. It is helping them out and all, Yeah, taking care.